Death by breath. What if I told you that humanity will be faced with another pandemic each and every year for the foreseeable future? It's not COVID-19, it's much worse than that. Airborne transmitted illness is the invisible and non-infectious pandemic that kills more than 8 million people every year. The air we breathe is a silent killer. In the next 10 minutes, I will convince you that air pollution is our greatest threat to humanity, and I will challenge you with 3 specific steps to help alter the world's trajectory. Imagine this. It's early morning in June, and I'm at our family cabin in northern Minnesota. As I walk to the edge of the dock, the aroma from my cup of coffee is replaced with the smell of fresh air. On the lake, surrounded by pine forest, the air invigorates my lungs and frees my soul. 4 weeks later, we're back on that same lake and waken one morning to a smoky haze that totally obscures our view of the water. I step out to investigate, but quickly retreat after reacting to the smoke. There would be no coffee on the dock that morning. Wildfires over 300 miles to the north were raging in Manitoba. We'd been on that lake for more than 20 years, had never seen anything like this. We've heard of the devastating California wildfires. I've even experienced the skies of Singapore that were polluted by wildfires from 1,000 miles away. And we've all, of course, seen satellite images of rainforest deforestation in South America. But toxic wildfire smoke, that's not a Minnesota thing. Never before had our noses reacted so quickly. Did our lungs constrict? Did we have grit in our throat? Escaping to the cabin interior, it wasn't much better. The air pollution had permeated every room. Over the next 10 days, Minnesota would record the worst air quality on record. Our air was not safe. Our air was not safe. My wife, Karen, loves techie gadgets, and she has this really slick personal air quality monitor. That day, it told us that the ultrafine particle levels inside were off the charts. I've learned a few things about respiration and breathing as an anesthesiologist, caring for over 20,000 operating room and intensive care patients. Last summer, I took that breathing interest to a new level. I became sort of an air nerd. I just happened to have a laser-based ultrafine particle counter that measures particles from 0.3 all the way up to 10 microns. They are so small, you cannot see them with the human eye. The outdoor readings those days showed us that we had nearly 1 million of these 0.3 microns per cubic foot. Do you know what that means? 1 million tiny invisible particles in a box like this. That week we learned firsthand about wildfire smoke and all airborne pollutants that blow far and wide, traversing borders and, of course, all geographies. We were fortunate to be able to stay indoors and deploy a high-tech air pollution and air purification device. Underserved populations, however, may not have that opportunity, and in fact, they may pay or carry a greater burden of disease. We often think of airborne transmitted diseases as being caused by viruses and bacteria, but it's really these micron-sized particles from combustion and manufacturing that kill the most. No person, no organ is spared. According to the global burden of disease, 1/4 of all heart attacks and strokes are directly related to ultrafine particulate pollution. Those particles are 1/50th the size of a hair. They penetrate deep down into your lungs, and once there, they cross the thin lining of your alveoli or your lung sacs. They enter your bloodstream where they circulate in the millions until they're taken up by your organs, where they cause disease and destruction. And much to my surprise, 16% of all dementia worldwide. United Kingdom scientists conducted autopsies on young adults that were killed in auto accidents. These 20-somethings had thousands of these ultrafine particles lodged into their heart muscle just from breathing the London air. You see, once inside, these microparticles never leave. You can't ever exhale them out. Once they are in your organs, they are there where they alter your immune function and they cause inflammation. And that's what leads to heart, lung, liver, vascular, and brain disease. Stanford researchers, they even found that wildfire particles permanently alter immune function in children, putting them at greater risk of infection. Pregnant moms exposed to this pollution have more complications at delivery, and they deliver smaller babies, and many of them have lung disorders. Some of those lung disorders may last a lifetime. We also have these compounds generated from manufacturing processes, and these have no natural means of breakdown. These toxic, forever chemicals are vented into the atmosphere where they widely circulate. Even ozone is toxic. You know, it may be healthy for the atmosphere, but here at ground level, it's deadly. Invisible airborne pollutants are everywhere, creating this unrelenting pandemic of indoor and outdoor air pollution. It's responsible for 1 out of 5 deaths. So I've got a question. If so many people are dying of this every year, why is it that most of us have never heard about the extent of air pollution related deaths? The answer, of course, like many things, is really complex. It may be due to the invisibility of the particles themselves. We can't see them, so we don't fear them. It may be delayed recognition, or it could be just plain denial, knowing that it's nearly impossible to fix this problem. There, of course, are many other reasons as well. Well, it's not all bad news. The Environmental Protection Agency just published recommendations to improve indoor air quality. And the White House, they're organizing a Clean Air in Buildings program. And last year, the World Health Organization updated their newer air quality standards. The catch, unfortunately, 99% of the world's population lives in areas that do not meet these standards. 99% of us live where the air quality is not only in question, but the air quality could be deadly. I'd say we've got some work to do. Our species, we're at a tipping point. We may not share the same food or the same water, but we all share the same air. Maybe we should just stop breathing. No. Hopefully you're feeling a little uncomfortable. You should actually be anxious about the air that you're breathing. And you should now be ready to take these urgently needed steps. First, start by monitoring and treating the air in your breathing space. After all, you spend over 90% of your time indoors, and track outdoor air quality on your phone or device app. Secondly, those of us in healthcare, we must adapt an airborne illness risk, an AIR score or assessment, to determine our patients' breathing environment and to define their total lifetime exposure to airborne pollution, or their aerosol. Third and last, and this is most critical, we cannot address the 8 million deaths every year from air pollution without a transparent conversation about our most visible pollution, and that's combustion. I have to ask, when did it become okay to use the sky above us, literally the air we breathe, as a waste dump site for the products of combustion and manufacturing? Especially when we know that the most efficient atmospheric filter is your lungs and mine. Never before has all of humanity more fully understood the meaning of death by breath. Why don't we all try to give everybody Minnesota Lake Country air?